So, considerations for a lumbar spine.
Just pants for sure.
Pants, yeah.
Change
These
into
ones,
scrubs.
yeah, and these ones, see how they like bunch up when they tie? We usually just try to have them tie them loose. And so otherwise, yeah, you kind of get like a little bunchy artifact in there, but yeah, usually scrubs over, even sweatpants, because sweatpants have the little metal eyelets on them where the things come out. So we see those all the time, like right over top of kind of L5, S1, right in the way. So, what about women? What do you change on women?
Bras.
Bras, come on.
Because
Yeah, clips in the back. Even if they say, oh, I don't have any underwires,
Take it
it's
off.
the clips in the back. Or they'll say, no, the clips are plastic, they're not metal.
Even though
They are always metal. I don't know who thinks they're plastic, but they're always metal. Yeah, so just have them fully change it so much easier. Okay. So we are on a 14 by 17, and where do you like to center for this?
Find the iliac crest and about 3 fingers up to L3.
Yep, I'm gonna right at L3. Our trick is to go about 2 to 3 fingers above. Now this trick, you have to be careful. If you have a very large patient, when you are feeling their crest, you are normally not feeling the bone. You are actually feeling the layer of fat over top of the bone when you push in on them. And so you might think, oh, well, that's crest right there. And then you go 3 fingers above that and you end up like at L1. It's because you're actually feeling the layer of fat on top of their crest. So if they're real big and you feel that kind of layer on top, you're probably at about L3 right there. So sometimes we feel the crest and it's actually a lot higher than what we think because it's not really the crest that we're feeling. So be a little bit careful with that on bigger patients, but once you get your light field on here, we'll talk about your top and your bottom margins and how to verify positioning.
Okay.
So where'd your marker go?
On the outside.
Perfect. Yep. Good. Just off of the midline. And it's easier to put your marker on at the beginning because once you're all lined up and you collimate in, you pull that out to put your marker on, the collimation opens up and you got to do it again. So just put it on at the beginning.
Okay, so I'm going to feel his crest way up here.
It is super high.
It is. Okay. It's not there, so I'd say 3 fingers from that.
Okay. 2 to 3 fingers, depending on finger width. If it seems real high at 3 fingers, go to 2. Just above the crest. Because what level does crest sit at?
No.
2, 3, 4, 5.
5.
4 or 5?
4 or 5.
Yeah.
Crest is at L4-5 interspace.
Looks a little high on him, doesn't it?
Because his
He
iliac
has
crest
high.
is
Yes,
high.
yeah. So if that looks too high, I think that's perfect.
Yeah.
If this is the top of his pelvis, we know 4-5 is here, and we want to get all the lumbar spine. I think that actually looks real good. Now we're going to verify by,
Xiphoid
if
process.
you think it's too high, check your xiphoid. His
Is that
xiphoid's right there.
T10?
That's like 9-10. So if that's 9-10, 11, 12, 1, 2, might be a hair, but 3, 4, 5, we know his crest is here. So we know he's going to be pretty tall. I think that looks just fine. I think that would be perfect.
Shoot it and see if we're right.
Yeah,
Shoot
let's do it.
Yeah, and on these ones, you don't need to do your top to bottom collimation, just your side to side. Yeah, and you want about kind of a 4 inch across, because remember divergence, by the time 4 inches gets down there, it's going to be a lot bigger. So there you go. Yep, good. Very nice. Yep. Breathing instructions.
For the lumbar,
Expiration.
yeah, expiration.
Expiration. Why do we do expiration?
Because it makes the diaphragm pull everything up.
Yep, because if he does inspiration, his diaphragm's going to come down here.
And be in the way.
Most important on the lateral, but we just try to make it consistent. So we'll do these. You'll see some techs, you'll hear them do this on inspiration, or they'll just say stop breathing, but it's nice to be consistent throughout a series. We know on the laterals we're going to do expiration, so we do it here as well. And that just gets that diaphragm up, makes all this density kind of the same.
It looks so small on John. It looks like, how is that holding you up?
Yeah.
I know.
All your weight.
How does that work? Okay.
Good. Very nice. Okay.
Okay, the next one is a lateral, which is also L3. So I'm going to have you
Okay.
turn over onto your left side.
Oh, one more consideration. Wait, roll on your back real quick. One more thing we forgot. What did we forget to do with his legs?
Oh,
Bend 'em
bend
up.
them.
Yeah, reduce the lordotic curve.
That's right.
Yeah. He doesn't have, because he's
Men.
so tall and he's a man, he doesn't have a really big lordotic curve. Women are bad. Especially because we're always, you trying to stick your butt out all the time.
Well,
and so
some
your,
of us don't.
your back naturally will kind of take on. So men typically have less of that. But still, this is going to be more comfortable for them. A lot of times too, when they're lying down, we'll just tuck a couple pillows under their legs, and that just helps to get that up.
Just a
But this-
slight bend. is
Yeah, I
good.
mean they don't need them up at
should
their
never
chest,
give
but
me a
this
camera.
this is going to be real nice.
Like,
Okay. Okay.
Would you also
have you-
shield him? If
Yes.
You can?
Yeah. Where's our shield?
Turn on, little.
a little thyroid
that's a
shield.
He doesn't need one that big.
Drop it on.
You know how I
Here, we'll give you this one.
No respect, no respect.
Okay, we're gonna have you turn over on your left side.
I don't know if I want to now.
His feelings
I
are
got
hurt.
the big shield, big shield.
Humongo.
Can you scoot forward a little bit?
And that's one thing I see students do a lot. You forget that you can give your patients instructions, so you're like trying to manhandle this and roll it around here, sweating all over. So tell your patient to scoot forward.
There you go. We're gonna get you nice and lateral.
Good. Yep. Arms up out of the way. Otherwise, you end up with elbows, and if they have big arms, you get like arm fat down in lumbar region. Those arms up out of the way. And this is good. They're allowed to have knees bent and be in a comfortable position here. If they try to straighten their legs, they're going to roll forward or backward. So they can have their knees bent up as much as they want. Be comfortable. With this position, do you want to try to evaluate and make sure they know they need to be kind of a neutral? We don't want them curled like in a nice, comfortable fetal position.
We're gonna straighten
And you
your
don't
back
want them
for me.
arched back. So you just want them in a nice, neutral
It looks a little curled.
Right. He's not, yeah, he's not, there you go, he's not bad.
Lead mat.
What are you doing over here?
You're messing with all of our stuff.
I was gonna pick it up in a second. Jeez, the last time I tried doing
Okay.
something nice.
Yeah.
But you don't have a big
don't think
hip
you have-
curve.
there's no-
Yeah,
You're
there's,
that straight.
There's no room under
Uh-uh.
there, you are
You are at the table.
straight, yep, and what actually we can do too is just have a little peek. And there you can see the line of his back, yep.
Let me see.
And also, we do this so that you can tell, sometimes you'll put your hand right here so that you can get
Know
them
if they're
lined up.
straight.
Yeah, and I'll kind of do that sometimes is just put my hand on either side of their back and roll them until I think they're straight. Because he was definitely rolled
Yeah.
forward.
He was
and
kinda
so you can,
curled.
you know, they have the open gown, so you can just open their gown up and
Mm-hmm.
see where you're looking and then cover them back up. But now see what we did here, we got his
We
hips
gotta
straight,
move 'em
but
forward.
look at his shoulders.
Yeah.
Oh yeah.
So we say, okay, stay here. You want your shoulders straight as well. Otherwise, those ribs are off, and his like L2, L1, T12 will all be oblique. So we want this straight, and you want this. So you want his whole back, and that's kind of what's tricky about laterals is getting everything in a nice straight neutral. Okay. So where are you centering here? Also L3. Okay. A little bit, so with divergent beam it should. Okay. Nice, yeah. And then he's pretty thin, so I think you might be a little too far forward on him. Yeah, you might need to be back up a little bit more. There you go. Yeah. If you have a very large patient where you think they have some back fat, you're going to want to center in a couple inches from their back. But he's going to be pretty much, like you can feel his spinous process. You know, if that spinous process, his vertebral body is not that far in there. So, pretty nice. Where's your marker on this one?
It's in the same spot.
Okay, let's draw. Remember we want to mark the front side, the anterior side, and he's in a left lateral, so we don't want to leave a right on there. That's why I use a left on all spines.
Yeah, so you don't have to
Yeah,
change
you just
it.
throw it on there, and then you always have that one out when you change your film.
I almost
And
feel
remember,
bad
his
for the
spine's
right,
going to kind of
like-
come down. His thoracic comes down, then his lumbar curves forward, and then sacrum.
see.
So I usually put it like up here. Yeah. Because otherwise, when his back comes down like this, if he has a lordotic curve, and women especially do, sometimes you get it kind of just in there, and then sacrum won't curve down here.
Okay.
Yeah, the right guy never gets used.
And then knees up.
I know. I know. People buy more lefts, and I have to replace more left markers.
Feel bad.
Go ahead and shield.
Okay, so
him.
now what's your shielding on him? What?
The bottom of symphysis.
Yeah. And how do you know where bottom of symphysis is?
Choking.
Greater trochanter.
Yeah, you can probably see on you.
Yeah.
Yeah, and you can even go a little bit forward. Because his spine is here, so even if we see shielding in the front, that's fine. As long as it's not in spine, we've got him covered. Okay? Nice. Yep, so let's collimate. Yeah, going through your mat on there too. Yeah, and now this is where you have to be careful. A lot of people go snug it right in there. Well, then you're in spinous process up here. So kind of right off his skin margin should be pretty good. And then you'll collimate in so that most of that's out of the way. Just protecting from back scatter there.
Oh, I was like, why did the collimation go away? But I opened the thing.
And what you can do on him too, because he's not perfectly straight on the table, his back is a little more. You can always turn that collimator box a little bit too, just to get that light field kind of more in line with this one. There's your lateral, yep, and then watch these arms. See how even on a thin person arm, when it's down too low, it's going to end up in light field. If they're big, they have like a lot of tissue. So yeah, they don't have to be way high, but just a nice comfortable, like in front of their face. Make sure to see how he rolled when he did that. Yeah.
Like a curled position.
Yeah. So you're constantly like on laterals, you do something, then you're reaching, refilling, readjusting, and the last thing you do before you take a picture is make sure one more time that they're
Don't
kind of
move
in line.
or
Yeah.
else.
There you go. Good. Okay.
Okay, and then we do an L5S1.
Just real quick, what was the technique on like AP and lateral? I didn't have
AP
to,
we
so-
do we would use AEC.
Okay.
What photo cell do you think you would use on AP?
Center.
Center.
And then nothing
It's like a
for the lateral, right?
You can use a center photo cell on the lateral as long as you know